pain interview includes questions about how often pain interferes with patients' lives in 3 categories: sleep, rehabilitation therapy, and day-to-day activities. Patients don't always use words that match the coding response options to describe their pain. So let's talk about strategies for getting clear responses and how to code the pain interview items when you are not able to get a clear response. For the purpose of the pain interview items, the term pain includes any type of physical discomfort in any part of the body, may be acute or chronic, continuous or intermittent, or occur at rest or with movement, and is whatever the patient says it is, and exists whenever they say it does. Your coding should be based on the patient's interpretation of the frequency response options. Let's listen in on part of a pain interview.
Over the past 5 days, how much of the time has pain made it hard for you to sleep at night?
I wake up from my achy back almost every night, but I'm used to it. I've been dealing with this forever.
Notice how the patient said achy back. This is an indication of pain, even though the patient didn't use the term pain. This patient's answer does not lead to a clear coding response, so the assessor will repeat the patient's answer to confirm they understand the pain experience, and then ask follow-up questions to better identify and code the patient's pain frequency.
I hear you saying that you have pain in your back. How often over the past 5 days has pain made it hard for you to sleep at night?
I'd say the pain frequently makes it hard to sleep. It's almost constantly, every night.
The patient still hasn't given a clear frequency response, so you would have to clarify further without interpreting the question or the response options for them.
Okay, let's better understand this. Which do you think best describes how often back pain affects your sleep? Would it be frequently or almost constantly?
Oh, I'm really not sure.
If the patient is unable to decide between 2 response options, you should code for the option with the higher frequency. In this case, you would code almost constantly. But what about situations in which the patient has even greater difficulty communicating their pain? You could suggest that they write, point, or use cue cards. In fact, CMS offers cue cards on the IRF and LTAC QRP web pages. If a patient is still unable to answer or gives a nonsensical response, you'll use code 8, unable to answer. Let's review. Pain is coded based on the patient's interpretation of the frequency response options. Listen for all words that indicate pain, not just the term pain. Ask follow-up questions to get the most accurate response from the patient. For more information, please consult the IRF-PI or LCDS manual.